Hi everyone, this is Dr. Greg Huddy with Spring Hill Health and Wellness. Today I just wanted to go over the difference between the different practitioners, like your general practitioner, your medical doctor, your PT, your physical therapist, orthopedic, or the chiropractor. Okay, so whenever you have an injury or pain to a joint in the body, it goes through three phases of healing. That does not change. So you've got the inflammation stage, okay, which takes about 72 hours. You've got the repair stage, which can last up from 6 to 12 weeks. And then you've got the remodel phase, which can last up to 12 months. Okay, so that stays consistent, okay? Which each practitioner, though, will do different things in different stages. So when you first get an injury, you go through the inflammation stage. So think inflammation, too, is always associated with pain. Those two go hand in hand. So your general practitioner at this stage will usually give you anti-inflammatories, pain medication, non-steroid anti-inflammatories, stuff like that to get the inflammation down, okay, and decrease the patient's pain within 72 hours. And usually at that time, depending on the practitioner's philosophy, they may give you also some natural. The chiropractor would give you more, we would do natural therapies from interferential therapy, stimulation, laser can be used at this time, or like passive range of motion a little bit this time. Ice is another one, a natural one that can calm this down. The difference between the general practitioner at this stage and the chiropractor at this stage is we're going to give you more non-invasive therapeutics to decrease the inflammation so they don't have any side effects in the long term. But generally you're still okay with just taking some medicine for just 72 hours. Now, in the repair stage, which can last 6 to 12 weeks, this is typically when the joint now needs to heal, okay, from the injury. Okay, so what we want to do here is usually a general practitioner, they'll still keep giving the patient the medication that they gave them up here into this time frame. The only thing with that, now you're going to run into side effects, complications, addiction stuff, and all that good stuff. So, and also too, some of that stuff affects the collagen, so you can't repair as well as you would if you weren't taking some of that medication. The chiropractor at this point will now want to deal with three ranges of motion to help that joint heal. The three ranges of motion are active and passive, okay? What we call overt range of motion, so you take as far as you can and then you apply a little pressure, and then the actual joint motion. Now the actual joint motion is what a chiropractor gets in there and adjusts, and you'll hear that little popping sound from a synovial joint. Nitrogen gas is releasing, and we're getting the actual joint itself to mobilize. Physical therapists typically do not get patients at this stage because it's a gateway practitioner. They get a lot of referrals from the general practitioner. So they usually, actually most PTs get a patient in this phase, remodel phase. In this phase, a PT will work the patient's active, passive, and a little bit of overt pressure, but they won't work the joint motion, okay, which is the key motion for healing. Because I can still, if you can still move this, the joint motion is the fulcrum to everything else. So the joint motion is the most important motion to be had. Otherwise, you heal wrong. I always tell my patients too, this misalignment here, if you don't bring it up here before the exercise, it'll heal wrong. It'll heal in a wrong motion state, so you'll have restrictions and pain. So here is where the chiropractor comes most into play right here, is the repair stage, okay? So after the repair stage, again, we get the active, passive, and the overt pressure and the joint motion as full as we can. You go into the remodel phase. The remodel phase is basically strengthening, remodel rehabilitation, physical therapy rehabilitation. And this is actually where physical therapists do a good job. Again, a lot of times when you go through these two stages, the elasticity of the joint isn't the same. The soft tissue, muscles, tendons, and ligaments aren't the same. So you've got to strengthen those up. So again, you don't have dysfunction in the future and long term, okay? But again, a lot of times we go from here, inflammation, giving medication, has side effects, skipping this phase, going right to here. once you go past 12 weeks without getting that joint motion in there, the most important motion, like I said, the actual synovial joint moving, popping, and mobility, then it will heal wrong now. And this is why we have so many back pain failures, as I call it, because they went through this phase and they healed wrong. And now they have scar tissue, they have tissue that cannot now fully get back to normal. Okay? So I just want to explain that to you guys. Hopefully you guys get some out of this. Hopefully it makes you guys understand the 3 phases of healing in which each practitioner comes into play. And again, the important role that chiropractic plays in healing every joint and making sure it's at its best. Thanks, guys.